So I know that, a person like this that has AMD in this condition, they also rely on their caregivers a lot to get things done. How have you seen the caregivers or family's life change besides the person who has this implant?
Well, the caregivers in the beginning are the most skeptical ones, right? They know their loved one is dependent on them, and they don't see an alternative because they never heard of it. So when you say, "Oh, I got this telescope and we're going to put it inside your eye," it doesn't flow off anyone's tongue very well. There isn't a catchphrase, telescope inside the eye. But then if you listen to them and say, "What's it like to take care of them? What does it mean?" Well, we talked about the fact that they can't do their checkbook. They can't do errand lists. They can't, we can't leave them alone in the supermarket if they wander off. You know, what can we do? So, and you start getting a little bit of an interaction. And to be honest with you, mostly it's the techs that pull it out. And I just hear it and you catch on a phrase. And then when you explain the telescope and what we expect it to do, that it's not going to make them fighter pilots, but it's going to give them a degree of independence. A degree of independence to a caregiver is wow. Not that they're burdened and they wouldn't do this caregiving, but I'm going to give back something, and usually it's a loved one or they have come to love this person. That degree of trust is, it's a beautiful thing. It is the most rewarding thing I do, and it fits in the world of keratoprosthesis for these patients that have been given up on. And that's why I feel very passionate about it. I challenge a company to make it better, make it straightforward, easier. Maybe we do other things with this. And the technology is just exciting. This is an exciting time to offer patients. And the caregiver comes back afterwards, after the surgery, and says, "Do I need to be here now? They got, I'll just stay in the car. I'll just stay outside, and your coffee's better outside than it is inside." And all these different things. You see a sense of relief. You see it's like, wow, I didn't realize that they could be happy, these patients. The depression of vision loss is real. It affects everyone around. And if you don't have good vision and you feel like something is sneaking up on you, you can't control it, you become bitter, you become angry, you become quiet. When that is opened up, then the caregiver's role is more supportive than, all encompassing.